Hi, my name is Jules Calixterio and my student ID is visible on the slide. This presentation covers Joy's case study, a 35-year-old woman with stage 2 left ovarian cancer who has undergone a left salpingo oophorectomy and is preparing for discharge. I will address the pathophysiology and clinical significance of her diagnosis, relevant pharmacological interventions, including mechanisms of actions and safety and their implications for nursing care. I will also discuss two specific post-operative nursing care strategies and appropriate discharge education using evidence-based research, and conclude with reflections on future nursing practice. A clear grasp of stage 2 ovarian cancer pathophysiology is essential for effective care, guiding treatment choices and anticipating complications. How cancer forms. Stage 2 originates in ovarian epithelial cells and spreads within the pelvis. At this stage, cancer extends to nearby pelvic structures, influencing surgical and chemotherapy plans. Estrogen and hormone receptors affect tumor behaviors and therapy responses, so hormonal status should inform treatment. Tumors can evade the immune system, which shapes immunotherapy approaches. Cancer alters cellular metabolism. Examples, it increases glucose uptake, impacting patients' energy and nutrition during recovery. Surgical complications may cause infections, bleeding, and hormonal shifts, all important for post-operative planning and future ovarian health. Understanding the disease guides appropriate surgical decisions and use of therapies like chemotherapy. Awareness of risk helps sets effective post-discharge monitoring and timely interventions. Informing Joy about her condition and necessary lifestyle changes supports active participation in her care, and addressing also Joy's mental and emotional impacts of cancer improves outcomes and quality of life. Joy's pharmacological treatment will mainly involve chemotherapy paired with medications to manage side effects. Chemotherapy targets fast-growing cells, including cancer, and this may cause nausea, fatigue, hair loss, myelosuppression, neuropathy, and kidney issues. Therefore, nurses should monitor for complications, educate on side effects and management, pre-medicate for nausea, track blood counts, and report adverse events. Monitoring hydration is important because it affects the kidneys. Second, targeted therapy may be considered for stage 2 ovarian cancer based on tumor markers, though they are not usually the first line. These drugs block specific pathways in cancer growth, and for safety considerations, the side effects depends on the drug and may include high blood pressure, fatigue, or blood issues. Therefore, nurses should track therapy-specific side effects, educate patients, and coordinate care. And lastly, supportive care medication. This help manage chemotherapy side effects and improve Joy's well-being. These are antiemetics to prevent nausea and vomiting, and non-steroidal anti-inflammatory drugs. Supportive drugs can cause side effects such as constipation, drowsiness, or allergies. Therefore, nurses should give these medications with precautions, monitor its effectiveness and side effects, and need to understand its medication's actions, benefits, and risks to ensure safe administration while working closely with a healthcare team. Joy after a left salpingo oophorectomy needs focused post-op care, especially in pain management and infection prevention. Pain management effectively control any post-surgical pain to prevent complications like respiratory issues, deep vein thrombosis, and delayed healing. Good pain management also improves comfort and recovery. Nurses should assess pain regularly using a validated scale, observing both verbal and nonverbal cues, administer prescribed pain relievers, as well as employing non-drug methods such as repositioning, splinting, relaxation, and distraction. Second is infection prevention. Surgical wounds are prone to infections, especially in cancer patients, leading to longer hospital stays and higher risks. Nurses should observe a septic technique when performing wound dressing, checking the incisions for infection signs, and report issues promptly. They have to observe and practice strict hand hygiene before and after wound care, and regularly check temperature, heart rate, and respiratory rate to spot early infections. It is also best to teach Joy on infection signs and proper home wound care to involve her in her treatment. These interventions support healing, enhance patient participation, and reduce post-operative risks. Joyce discharge education should use clear and brief instructions customized to her learning needs. Written materials may be, and involvement of family or caregivers are recommended. We have to teach Joy to keep the incision clean and dry, watch for infection, and explain the importance of taking medications as prescribed, and discuss non-pharmacological pain relief strategies like repositioning and relaxation techniques. Advise gradual increase of activity, avoiding heavy tasks, and recommend a balanced diet to support healing and recovery. Encourage adequate hydration as well. List follow-up appointments to attend to, and recognize emotional challenges and share support resources and groups. And lastly, emphasize the importance of quitting smoking and moderate alcohol intake. Provide resources to assist with the smoking cessation, and all of this should be documented throughout in her medical record. In conclusion, Joy's case offers several lessons to improve my future nursing practices. This highlights the importance of addressing patients' physical, emotional, psychological, and social needs, especially in oncology nursing. Integrating current research into clinical decisions is essential for effective patient care, and ongoing education ensures interventions remain aligned with best practices. Clear communication helps patients understand their conditions and manage self-care after discharge. Coordinating with healthcare team members is a must, as well as recognizing and respecting diverse backgrounds that allows tailored and culturally sensitive care for each patient, encouraging lifestyle modifications to support recovery, and lastly, staying current with the new trends in the evolving field of oncology nursing. And here are my references. And the second one, and the final one. Thank you.